Hi, I'm Dr. Chandresh. I'm a consultant psychiatrist here at ANC Gachibowli. Today I'll be talking to you about how we treat depression. So depression can generally be treated in three ways. Primarily medication, we call as psychopharmacology. The second is to do psychotherapies, something like CBT. The third one is through neuromodulation, such as TMS and ECT. So coming to the first one, which is medication. Commonly, a class of drugs called SSRIs are used. These are drugs which increase the brain levels of serotonin. And when presenting with the first episode of depression, usually medication has to be taken for about 6 to 9 months. If it is a second episode, then it may have to be taken for up to 2 years. For the vast majority of people, depression is not a lifelong condition. It is not like diabetes or hypertension, where once you start them on a medicine, it has to be taken lifelong. That is not the case for the vast majority of people with depression. On average, to know if a medicine which has been started for you is working or not, it takes 2 to 3 weeks. And for some people, it works. For others, it doesn't. So then another medicine is started, replacing the first one. And this second medicine again has to be given for about 2 to 3 weeks to see if it is effective or not. So this confusion about the time scale in which improvement occurs in depression often leads to patients stopping medicines or going to multiple doctors, and so different drugs are tried for different amounts of time without really knowing which drug is actually going to be helpful. A second way to treat depression, especially the mild and moderate depressions, are talk therapies, also called psychotherapies. An example of psychotherapy that is commonly done is something called cognitive behavior therapy, also called CBT. In CBT, a triad of cognition, behavior, and emotions is targeted. Usually it is seen that in people with depression, they have specific negative thought patterns. We call these as cognitive distortions. And so you would, in consult with a therapist, come up with a thought record, and the therapist would help you identify certain cognitive distortions and look for better evidence of why this may be true or not. The other component of CBT is the behavior. And to change behavior, techniques like activity scheduling, behavioral activation, breaking down a complex behavior into simple steps in order to achieve them are taught. For CBT, usually the patient meets with the therapist once a week for a few months. The third way to treat depression is using neuromodulation, which includes techniques like transcranial magnetic stimulation, TMS, and electroconvulsive therapy, ECT. TMS is an outpatient procedure. Here we use certain magnetic pulses to target certain regions of the brain which have been implicated in depression. And treatment usually takes a week or so. There is no specific preparation required. You can walk in, get the treatment, and go back to work. The patient is usually required to be here for half an hour or so. There is no use of any anesthetics or any other drugs. ECT is usually done in severe depression, especially when it is associated with psychotic symptoms of hallucinations and delusions, and also in cases of severe suicidal ideation. ECT requires an inpatient admission. Here, electricity is passed through the brain, not right out of the plug. It is through a machine. It is well controlled. It is at an adequate dose in order to produce a seizure within the brain. ECT is not as scary as it looks or it has been made to look in movies. It is a perfectly safe procedure when done in a supervised environment, and it is often life-saving for a lot of people with severe depression. So I hope you found this video insightful. I'm sure you have more questions. You can drop them down in the comments below, or if you feel you need to consult with a psychiatrist, you can always come down to our clinics. We are here to offer you a comprehensive management plan after an evaluation.